it looks like you're it looks like you're the only one who is on the Zoom call right now. So if you have any questions at any point, feel free to unmute or type them in the chat or raise your little hand icon. This doesn't have to be a super formal presentation or anything like that. It can be a little bit more of a conversation if you have any questions. So feel free to interrupt me at any point, but we'll go ahead and get started. So my name is Maggie, and I am a community health worker with the Cancer Center at UConn Health over in Farmington. So I do a lot of community outreach and educational programming and things like that. And so I am here to just provide some information on some of the most common types of cancer, certain risk factors for those, how to prevent them, and as well as what the screenings for those look like, and the importance of early detection. All right. So we're going to skip ahead here a little bit. Okay, so for the cancer basics, cancer affects 1 in 3 people in the United States. So, as you can see by that statistic, it's very prevalent in the lives of a lot of people. And if you are in a group setting, chances are a lot of those people, about 1 in 3, have been affected by cancer either directly or indirectly through having a family member or another loved one who has been more directly impacted by cancer. And then just some overview on certain terms. There are 2 different types of cancer categories. So the first is hematologic or blood cancers, and these are cancers of the blood cells, including leukemia, lymphoma, and multiple myeloma. And then you have your solid tumor cancers, which are cancers of any other body organs or tissues. So the most common solid tumor cancers are breast, prostate, lung, and colorectal cancers. And those are the cancers that we're going to talk a little bit about today in more depth, as well as skin cancer. And then there are 2 different types of tumors. So you have either benign tumors, which grow more slowly and do not spread to other areas of the body. So these benign tumors are not cancerous tumors, whereas your malignant tumors grow more quickly and they can spread to other areas of the body. So these are your cancerous tumors. So sometimes you might hear these terms talked about by your doctor or another medical provider. So it's just important to know the difference between these. Okay, so now we have several tips to help reduce your cancer risk. So the first is don't use tobacco. And this is because smoking, vaping, and chewing tobacco have been linked to many types of cancer. You often think of tobacco used in smoking as being linked to lung cancer, which is certainly true, but it's also been linked to other types of cancers as well. The second tip is to eat a healthy diet. So you want to make sure you're focusing on whole foods and limiting the processed foods that you're consuming. And this doesn't mean that you have to be super strict in what you're eating all the time. It's important to have a balance, and you can treat yourself in moderation and eat some of the foods that you really enjoy. But you just want to make sure that you're getting enough nutrients in your diet to stay healthy. So the third tip is to be physically active, which can help to control your weight and lower your cancer risk, because being at too high of a weight can increase your risk of developing certain types of cancer. And this looks a little bit different for everybody. So it's important to move your body in ways that feel good. And so for some people, this might look like going for a run, but for other people, it might look like going for a walk or doing a group exercise class. So you just want to find something that you can fit into your routine and that feels good for you. And the next tip is to maintain a healthy weight, which we just talked a little bit about. Being at a healthy weight can certainly help lower the risk of many types of cancer. The next tip is to protect yourself from the sun. And so you want to make sure that you're limiting your time in the sun and using sun protection. And we're going to go a little bit more in depth later when we talk about skin cancer. Next, we have to get vaccinated. And this is because vaccines can help prevent against certain viral infections that increase cancer risk. So you just want to make sure that you are following the recommendations from your doctor about which vaccines you should be getting. Next, we have to get regular medical care. So you want to make sure that you're going to your annual checkups, you're performing your routine self-exams, and you're getting all of the required screenings. So just following any advice that your doctor may give you. And finally, you want to make sure that you're limiting your alcohol intake. So you're just drinking alcohol in moderation, if at all, just to maintain a healthy level with this, because alcohol use has been shown to increase the risk of developing certain types of cancer. And so this seems like a lot of information and a lot of different tips. So feel free to take a screenshot of this or take a picture with your phone if you'd like, but this all should be available on the YouTube channel after. All right, let's see here. Okay, so we're going to get into some of the more specific types of cancer and what they look like, some risk factors for them, and then what the screening process looks like for each of these. So first we have colon cancer. So colorectal cancer is the third most common cancer among men and women in the United States. And many colon cancers begin as polyps. And this might be a term that you've heard before if you have gotten a colonoscopy or have had some of those conversations with your doctor. And polyps can either be benign or malignant. Sometimes the polyps are not cancerous, they're benign. And during your colonoscopy, the doctor can just remove them right then and there. But sometimes those polyps do eventually turn into colon cancer. So it's important to make sure that you're staying on top of all of those. And certain behaviors can improve your overall health and may reduce your risk of colorectal cancer. So that includes many of the tips that we talked about on the previous slide, such as eating more fruits, vegetables, and whole grains, limiting your red and processed meat intake, sugary drinks, and refined grains. You want to make sure that you're being as physically active as you can and follow any screening recommendations from your doctor. And we're going to go over some of those recommendations on the next slide. So these are the screening guidelines for colon cancer. So everyone should start regular screenings at age 45 and should continue having a colonoscopy every 10 years. However, if you are at high risk for colon cancer, your doctor may recommend that you begin screenings earlier or get them more frequently. And so you just want to make sure that you are having those conversations with your doctor because the screening guidelines may vary a little bit from person to person. So typically it's age 45 when you begin, and then you want to have that colonoscopy every 10 years, but sometimes you might need them more frequently or at an earlier age if you're at a higher risk. And it's important to know that there are other screening tests for colorectal cancer. You may have seen commercials for things like Cologuard, and there are other tests out there, but colonoscopies are considered the gold standard and are often the most reliable method of detecting colon cancer. Okay, so next we have breast cancer. So breast cancer is the most common cancer in women aside from skin cancer. Although breast cancer is more common in women over the age of 40, younger women can also get breast cancer. So it's important to be having these conversations with some of the younger women in your life. Breast cancer, the risk for that really increases with age, but it can occur in women who are younger than 40. One of my coworkers developed breast cancer in her 30s. And so it is something that is very real and it can happen to anyone at any point. And it's typically in older women, but it can happen to younger women, and it can also occur in men. So men can get breast cancer, but it is more rare. It's about 100 times more common in women, but it can occur. It is a possibility. And then on the left here, we have a little graphic of some of the risk factors of breast cancer. And so sometimes there are risk factors that you can't control, such as your race, your gender, with breast cancer being more common in women than men, your genetics. So sometimes your genetic makeup can increase your risk for breast cancer, and that's something that's out of your control, and your age, because breast cancer, the risk for developing it increases with your age. But then there are some risk factors that you can control. And again, some of these will sound really familiar based on what we chatted about earlier. But exercising, food, alcohol, smoking, and maintaining a healthy weight, those are all things that can impact your risk for breast cancer. And those are things that are in your control, as well as chest radiation. So you want to make sure that you're not getting any unnecessary radiation exposure. So there are some things that you can't control, but a lot of things that are in your control, and you can work towards developing a healthier lifestyle and then hopefully reducing your risk for breast cancer. So these are the screening guidelines for breast cancer. It is recommended that you get a clinical breast exam performed by a medical provider at least every 3 years starting at age 20, and then every year starting at age 40. And then the most common type of screening for breast cancer is a mammogram. So every year, starting at the age 40, if you are at average risk, is the guideline for mammograms. Um, and so typically at age 40, you'll begin getting a mammogram every year. And you want to make sure that you are following your doctor's recommendations, because sometimes your doctor might recommend that you get screened either earlier or more often if you are at a higher risk for breast cancer based on certain factors like your family history or genetics. And so it's important to be staying on top of your mammogram screenings as well. All right, so next we have prostate cancer. And prostate cancer is the most common cancer among men in the United States, aside from skin cancer. So it is very important for men to be staying on top of their prostate cancer screenings. And each man's risk of prostate cancer can vary based on age, race and or ethnicity, and other factors. Because the chances of having prostate cancer rapidly rise after age 50. And so when men turn 50, their chances of developing prostate cancer are greatly increased. And another interesting statistic is that prostate cancer develops more often in African American men and in Caribbean men of African ancestry than in men of other races. And researchers aren't entirely certain why this occurs, but you can see in the chart down below here that the rate of new cases is considerably higher in non-Hispanic Black men. And so it's important that all men, but especially these non-Hispanic Black men, are getting screened so that they know if whether or not they have prostate cancer or have a greater chance of developing it. Some other factors include family history, genetics, diet and obesity, smoking, chemical exposures, and sexually transmitted infections. So these are all factors that can also contribute to a man's risk of developing prostate cancer. All right. So these are the screening guidelines for prostate cancer. And it's important to note that men should make an informed decision about screening with their healthcare provider because your medical doctor can provide some specifics based on your individual risk for prostate cancer, because there are a number of factors that impact that. So age 50 is when the discussion about screening should take place for men who are at average risk of prostate cancer and are expected to live at least 10 more years. And this changes for men who are at a higher risk of developing prostate cancer. So the discussion about screening should take place at age 45 for African American men and men who have a first degree relative, so either a father or a brother, who have been diagnosed with prostate cancer at an early age, which is defined as younger than age 65. So if a man falls into this category, then they would begin screening for prostate cancer at age 45. And then the age drops down to 40 for men who are at an even higher risk of prostate cancer, which includes those with more than one first degree relative. So more than one, either father or brother, who had prostate cancer at an early age. And the screening for prostate cancer includes a prostate specific or PSA blood test. So it's just a pretty simple blood test. These men would go and get their blood drawn. And from there, the blood sample would be sent off to a lab, and they would be able to determine whether or not that individual has prostate cancer. All right. So next we have skin cancer. So skin cancer is the most common type of cancer in the United States by far. There are more incidences of skin cancer than any type of other cancer throughout each year. And skin cancer is the risk for developing skin cancer greatly increases with sun exposure. And so these are some of the guidelines to help prevent skin cancer, which include using sunscreen with at least SPF 30 year round. You want to wear sun protective clothing, so clothing that covers as much of your skin whenever you can. I know it's a little bit easier in the colder months as opposed to when it's warmer outside and you don't want to have as many layers on. But it's important to just make sure that you're protecting your skin when you can. You also want to avoid sun exposure during the middle of the day when the sun is at its highest, typically around 10 a.m. to 4 p.m. You want to avoid indoor tanning beds. These are really damaging to your skin. So it's important to avoid using these and encourage other people in your life to avoid using them as well. You want to perform regular skin self-exams, which we'll talk about next, and report any changes that you notice to your doctor or dermatologist. So if you notice any spots that weren't there before or perhaps look a little bit different, it's important to talk to your healthcare provider about those. And I also wanted to mention that a lot of people think that during the winter months when it's colder, it's not as important to wear sunscreen, but I just want to point out that it's important to be using sunscreen year round, because the sun can still impact your skin no matter the temperature. And so it's important to make sure that even when you're outside in the cold months, you have SPF 30 or more on any exposed areas of your body. All right, so next we have some of the guidelines for skin cancer screening. So on the left here is a description of how to perform a skin cancer self-examination. So first you want to examine your body front and back in a mirror, and then look at the right and left sides of your body with your arms raised. So you want to be using a large mirror for this, preferably full length if that's available to you, and just examine your body front and back, and then the left and right sides as well. Next, you want to examine the back of your neck and your scalp with a hand mirror. So you're going to part your hair for a closer look at your scalp as well. And sometimes it can be difficult to see all of the areas of your scalp. And so if you have someone in your life that you trust and would be willing to help look at some of the more challenging areas to see it's important to try to recruit their help, and you can do the same for them, and that way it's helping to hold one another accountable for making sure you remember to do these self-examinations as well. All right, so third, you want to bend your elbows and look carefully at your forearms, underarms, and palms. Next, you want to check your entire back side with a hand mirror. So just making sure you're looking at all of those areas of your skin that aren't as easy to see. And finally, you want to check the backs of your legs and feet, as well as the spaces between your toes and the soles of your feet, which might seem a little bit silly. You might think that those areas aren't getting quite as much sun, which is true. Typically, the soles of your feet and between your toes aren't as exposed to the sun as other areas of your body, but it's important to make sure that you're checking all areas of your skin. All right, and then on the right, we have the A, B, C, D, E's of melanoma. So this is an acronym to help you remember what you should be looking for when you check your skin, because melanoma has some characteristics that can help you recognize when you have one of these spots. And so the A stands for asymmetry, which means one half of the spot is unlike the other half. And so you can see the little picture next to that. The spot is kind of irregular in its shape. So one half doesn't look quite like the other half. And then the B stands for border. So the spot has an irregular, scalloped, or poorly defined border. So it's not a perfect circle. And so that's the B. And then the C stands for color. So the spot has varying colors from one area to the next, such as shades of tan, brown, or black, or areas of white, red, or blue. And so melanoma often shows up with varying colors and not just all one color, although it certainly can be all one color in some cases. The D stands for diameter, which means that while melanomas are usually greater than 6 millimeters, or about the size of a pencil eraser, when diagnosed, they can be smaller. So typically, melanomas are bigger than the size of a pencil eraser, but sometimes they are a little bit smaller when they're first developing. And finally, the E stands for evolving. So the spot looks different from the rest, or is changing in size, shape, or color. And you can see the example below there of a spot that's growing in size and becoming a little bit more irregular. So often melanomas don't stay the same when they develop. They change and look a little bit different from time to time. And so these are really important to remember when you're performing these skin cancer self-examinations, just so you know some of the things to watch out for. Okay, so next is lung cancer. So lung cancer is the leading cause of cancer death worldwide. So even though lung cancer isn't the number one most common cancer, it causes more cancer deaths than any other type of cancer. And the number one risk factor for lung cancer is smoking, which is why it's so important to make sure that you are limiting your smoking and your tobacco use. And early detection of lung cancer has been shown to greatly improve survival rates, which is why it's important to be having these conversations with your doctor. And if you have a history of tobacco use or smoking, to talk to your medical provider about that to see if you would be eligible for a lung cancer screening. And on the left here, we have some more risk factors of lung cancer. So we have the controllable risk factors, which are tobacco and secondhand smoke. And so you just want to make sure that you're limiting your use of those. And then we have exposure to radon, asbestos, and toxic workplace chemicals. And so you want to make sure that you're checking your home to make sure that you don't have any of these harmful materials in your home and the place that you're working. And then we have some non-controllable risk factors of lung cancer as well. So your genetics might play a role, and your family history could reveal a genetic risk for developing lung cancer. And we also can't control air pollution entirely. Unfortunately, there is pollution in the air that we can't necessarily avoid. We can certainly take steps to limit our exposure to pollutants. We can wear a mask if that's something that we want to do, or avoid areas with more air pollution. But unfortunately, we can't avoid it entirely. And the final non-controllable risk factor is radiation therapy. And so sometimes we have to get certain radiation treatment for other medical reasons, and we can't necessarily avoid getting that treatment. So those are some of the risk factors for lung cancer. And these are the screening guidelines that the American Cancer Society has put out for lung cancer screening. So the first guideline is that you are 50 to 80 years old and in fairly good health. Additionally, you must either currently smoke or have quit within the past 15 years. And finally, you must have at least a 20 pack year smoking history. And so pack year is determined by the number of packs of cigarettes per day multiplied by the number of years smoked. So, for example, someone who smoked 2 packs a day for 10 years has a 20 pack year history of smoking, because 2 times 20 or 2 times 10 is 20. And similarly, someone who smoked 1 pack a day for 20 years would also have a 20 pack year history. And so this is something that you would calculate with your doctor to determine your pack year smoking history, and determine if you meet these screening guidelines. And the screening process for lung cancer is called a low dose CT scan. So it's a pretty simple X-ray image of your lungs, and that's able to determine whether or not you have lung cancer. I also wanted to highlight a smoking cessation program that we will be offering at UConn Health, called Freedom from Smoking. And this is a program that was developed by the American Lung Association, and it's backed by a lot of research, and has proven to be very effective in helping people to quit smoking and stay quit. It can also be applied to not just smoking cigarettes, but any tobacco use, or vaping or e-cigarette use. And some of the things that are covered in this program include how to know if you're really ready to quit, as well as FDA approved cessation medications that can increase your success in quitting, lifestyle changes to make quitting easier, how to prepare for your quit day, coping strategies for managing stress and avoiding weight gain, developing a new self image, and how to stay tobacco free for good. And so, this is a program that we are very excited to be able to offer at UConn Health. And if you are interested in this program, or you know of anybody who might be interested in this, my contact information is on the last slide. So feel free to reach out to me, and we can discuss some of the next steps for that. But I just wanted to highlight that program as well. And then I have a video here from the American Cancer Society that I think really just reinforces the importance of cancer screenings and making sure that you're staying on top of all of those. So I'm going to go ahead and play that, and just let me know if you have any trouble seeing it or hearing the audio to the video.
I don't hear any audio, if there is any right now.
Okay. Thank you. Let me see. Not quite sure how to share the audio as well. Let's see. Okay. I'm not sure how to share the audio um with that goes to the video. So I'm gonna put the closed captions on so that you're able to read along as it plays. And it's just a minute, so it's not super long. All right, so I think that video really just emphasizes the importance of um, making sure that you're staying on top of all of your screenings. Um, and, early detection is so important in improving survival rates. So I think it's a very important conversation to have. Let's see. Okay. I also wanted to highlight some of the UConn Health team. Um, in our cancer department. So this is not an all-encompassing list of our team because there are so many different branches of it. But see, these are some of the faces that you may see in our team who provide care to our patients. And my supervisor always says that UConn Health is small but mighty, and all of these individuals just really are centered on patient care, and want the best for everyone coming into UConn Health. This is our outpatient pavilion at UConn Health. Um, and this is where a lot of our services take place. And it was recently built, I believe, in 2017. So it's pretty new and beautiful, with all of the big windows there. So you will certainly be in good hands, if anybody so chooses to receive their care at UConn. These are some more images of our comprehensive cancer center. So we have a lot of different departments, and again, we are just really focused on patient care and experience and providing the best possible treatment to all of our patients. All right, and finally, this is my contact information on the screen here. And so my role as a community health worker is to provide cancer education, assist patients in scheduling screening visits, and follow patients throughout their care. And so my phone number is listed below there. If you have any questions in the future, or would like assistance in scheduling any screenings, I would be more than happy to have some conversations about that. Um, but that is all I have for you guys today. I'm happy to answer any questions that you may have, or if you have anything else to add. Um, I'm happy to stick around for a little bit and chat. But thank you so much for tuning in today. And this is being recorded as well, and so you can always go back and watch any segments of it when the video is uploaded. So thank you again. And please let me know if you have any questions or need any assistance at any point.
Thank you so much.
Thank you. Have a great day.
You too. Bye.
All right, I'm going to stop the recording now.